Hello and welcome back to episode 99 of the IBS Freedom Podcast. Oh my gosh. I feel like a baby is growing up and we are the baby. Like, this is such a weird, surreal time to be recording this episode. But guys, this episode is going to be all about SIBO myths. Dun, dun, dun. Oh, there's so many. May I start?
Yeah.
May I start us off, my darling?
Right.
Okay.
Yep.
So some of you might know, so I have my YouTube channel, and one of the very first series, I think the first thing that I worked on that channel was a series I called SIBO Mistakes. And the idea behind it was, like, these are the mistakes that you might be making or the holes in your treatment plan that could be keeping you stuck in SIBO Never Never Land, right? And this is a little bit different than today's topic exactly, but the very first SIBO mistake that I talked about was treating it like it's the root cause or treating it like it's the primary condition.
Right.
So how many times have we heard well-intentioned practitioners or well-intentioned people say, we found the root cause of my IBS. We found the root cause of your IBS, the root cause of your bloating, et cetera, et cetera. It is SIBO. And it's like, kind of, right? Like, it kind of is, but also you need to dig at the deeper roots. Like, that's just a surface level root. Like, yes, the better way to word that situation is the appropriate diagnosis is SIBO.
Right.
Right? But like, you still need to look at the root causes of the SIBO and like why you got SIBO, what's keeping you stuck with SIBO. And that's basically what we have spent 98 other episodes talking about on this podcast, really, is like looking at those root causes, looking at things like hormones and nutritional deficiencies and nutritional status and stress and sleep and the microbiome. But that's the first one I wanted to throw out there, is that SIBO is not a root cause in and of itself of anything. Neither is leaky gut, neither is candida. There was a reason you got SIBO. There was a reason you got leaky gut. There was a reason you got candida. So you need to hunt for those deeper roots and not just stop the buck at, hey, I have SIBO. Cool, I found it.
Right. Right. No, I think that's a great one. I think too, sometimes like, just acknowledging that if you're at a provider that's not digging deeper at all, too, that could be really helpful. So, when the provider is not investigating what could be driving the SIBO, or that hasn't really been discussed, and maybe they have incorporated it in your plan and you just aren't aware.
Yeah.
Or they're just not, educating you on every little piece of their strategy, which I think happens too. But, I think it's a good conversation starter, like a good conversation to have with your provider of, if you're not sure, like, what the deeper roots are, to just try to discuss it with the doctor. And maybe the doctor kind of has some different ideas. Like, even at times, it's not overly clear what exactly the root cause is, or it's a compilation of different factors. So it's hard to know, is it 80% this and 20% this, or vice versa?
Yeah.
But these could be the factors at play. But I think just having an acknowledgement of what that could be for you is really important. So I definitely think that's a biggie. The root cause thing, definitely a biggie.
Yeah. And I like that you mentioned that it could be like 80% one thing, 20% another thing.
Right.
And I've seen people who have every single SIBO root cause known to man.
Right.
Like, I've seen people with like 10 root causes, and it's like, at the end of the day, you still end up treating it remarkably similarly, in the sense of like, all right, supporting digestive capacity, supporting nutrition, supporting, sleep and stress and the gut-brain axis. Like, you still do all those things, but it's like really satisfying to know why this happened to your body.
Right.
And it can help you try to prevent it in the future. So like, if taking Prilosec gave you SIBO, please don't do that again.
Right.
Like, you're going to try everything else before you take the damn Prilosec again, if you know that was your root cause. So,
well, and I think a lot of root causes are not mutually exclusive either. So, like, you have someone that has low stomach acid, which could be creating dysbiosis, which could be affecting nutrient deficiencies and optimizing nutrition. And again, like, there's just a lot of connections between a lot of different systems. Yeah. So, I think that can be that's why it's sometimes convoluted, but you can usually come up with like the factors that are at play for you, and maybe it's a little bit less clear of like what percentage is this, what percentage is that. It can become more clear, I think, as you implement things, because like if you're really responsive to this thing and maybe mildly responsive to this thing, it can give you indicators of, you know, what might be the biggest driver. But yeah, I think, do we want to hit on another one?
Yeah. Deal them.
Okay.
Bring them on. What's another SIBO myth?
I have a couple written down. Again,
okay.
There's some that I know. I think a big one is the probiotics in SIBO, which I know we've done like we've done its own individual episode on just probiotics for IBS and SIBO in general, but just like the extent of fear that some people propel on probiotics. And again, like I've heard, it's so crazy. Like I hear so many different opinions, I think, from people. And again, I think sometimes I hear the staunchest no probiotics from GI docs. I don't know if that's what you've heard, but
I feel like they just oftentimes don't give probiotics the time of day, regardless if you have SIBO or not. If they do, it's like VSL number 3.
That could be true, you know. But like, I've definitely heard like from definitely a number of clients where like their GI doc was like, "You're feeding the fire, you're just adding bacteria to the situation."
Oh gosh.
Which again, that's
not
kind
supported
of
by evidence at all.
Right.
I feel like I've heard that more from like the functional space, like people who have worked with other functional providers before coming to see me. Right. Or actually the worst probably is the Facebook groups. Right. When people, well-intended people, go on the Facebook groups and ask, hey, like what probiotic do you guys take? Or what probiotic do you guys recommend? Or if they share their protocol, because people will go on these groups and be like, hey, these are the 10 supplements I'm taking. Can you guys give me feedback on the protocol? Which is ludicrous because like they don't know. Right. Like these people aren't trained in any sort of medical or nutritional field 99.9% of the time. But they'll have other like normal people, lay people, check their protocol, and people will be like, "Oh my god, you can't take probiotics," and scare the willikers out of them. And yeah, we talked about this in some episode somewhere, probably the probiotic episode. But I want to reiterate, the bacteria that overgrow in SIBO are literally never bifido or lactobacilli. Maybe if you have like confirmed diagnosed short bowel syndrome, that's maybe the case to talk about the lactobacilli and the D-lactic acidosis thing. But aside from confirmed diagnosed short bowel syndrome, the average run-of-the-mill SIBO person, they've done aspirate studies. They've done tons of them at this point. And when they suck the juice out of the SIBO, it is never lactobacilli and bifidobacteria. It's pretty much, it's E. coli, it's Klebsiella, it's the gram-negative proteobacteria, and those are not available in probiotics, minus one that I can think of. So well, I think a lot of the fear is not founded.
Yeah, and again, I know we potentially I think, again, that one study, I think it was like Rao or something from Georgia who did the D-lactic acidosis that you're bringing up. Like that one study, I think, just like blew up, and people were like, "Oh, you know, you'll get brain fog," and you know, I think that was like really a big problem child in the whole landscape because it basically abandoned every other study. That
even though there's numerous studies,
that would contradict it. Well, and even like if you look at IBS at large, which isn't necessarily SIBO, but there's a decent percentage of people that have SIBO and IBS, and you know, generally, you know, there's sometimes mixed results, but I would say in general, there's been a lot of beneficial studies for probiotics, in the IBS space. So it's insane. I think, again, like there's also the mentality that these bugs are going to repopulate.
That doesn't happen.
It doesn't happen. I have to explain that to clients a lot, and I think sometimes it's a little bit confusing. But like, if you know, take a probiotic, it's not going in there and colonizing your gut per se, where you're repopulating missing strains. What it's going to do is create better terrain. It's going to be transient. It's going to like
poop it out.
Right, you're going to poop it out. Like if you stop taking that probiotic, you most likely won't have those strains unless you already had them to begin with. In there. Or maybe again, like they helped increase some of your good gut bugs by just creating some better terrain.
Yeah, or like crowding out some bad guys or modulating inflammation. Like that's kind of the ironic thing, is that probiotics are wonderfully helpful and they're a really powerful tool. But the reason they're a powerful tool has nothing to do with how long they stick around. Right. Because within a week you poop it all out, regardless of what type you take. The possible exception, theoretically, is the spore-forming probiotics. Like that's kind of their claim to fame, right? But if it's like a lactobacilli, a bifidobacteria, a streptococcus, akkermansia, like all of those, you're going to poop them out in the week. So, you know, and I will say too, because maybe there is somebody listening right now who's like a little bit pissed at us at the moment because they're like, screw you ladies, I've taken probiotics and I know I don't tolerate them. To be clear, I have seen numerous people with SIBO who don't tolerate probiotics very well. I just don't think that the problem is that you're adding bacteria on top of bacteria and make the SIBO worse. I have a video on that on my YouTube channel I think it's literally just called Probiotic Side Effects. And I talked about that more, but the kind of meat and potatoes of it was probiotics modulate the immune system and they change the immune response. So when you drop a probiotic in the tube, you don't know what it's going to do with your immune system necessarily. Right. And if you have dysbiosis or leaky gut or poor motility, like there's a likelihood that that probiotic is going to interact with your immune system. And oftentimes it's in ways that we are not capable of understanding and predicting. Right. So if you had a person, for example, who was more like Th2 histamine dominant and having some kind of low to medium grade histamine issues, and then you take a probiotic that, unbeknownst to you or anybody else, skews you further towards Th2 dominance and histamine issues. Right. You're going to flare up symptoms. But it doesn't necessarily have to do with what you're doing to the microbiome and what you're doing with like the overgrowth. It could be the quantity stays the same, or it might even help the SIBO, but it's what it's doing to your immune system. And with SIBO patients, oftentimes having a more higher predilection towards histamine issues and inflammation and like squirrely kind of immune function, it's kind of like this wild card that we can't fully predict. And then the probiotics are a second wild card. And I think that's what's happening. I think a lot of people have unwanted side effects from probiotics because of what's happening with the immune system. But if that exact same person was to make their immune system healthier and stronger and more resilient, and maybe work on their microbiome in other ways, they could probably tolerate that probiotic down the road. Right. But I don't think it's like bacteria on top of bacteria kind of thing.
Yeah, there's like a traffic jam of bacteria going on.
No.
Well, then I'll open the floor. Do you have another one that you wanna?
I do. Now, for those of you who are unaware, Amy is super duper pregnant right now. But when you're listening to this episode, she's going to be up to her eyebrows with baby vomit and poop and diapers and all the baby snuggles. But I say that because I'm going to say this. My most recent video, as of the recording of this episode in early June, happened to be about another SIBO myth, which is that iron is unsafe. You shouldn't take iron because it'll feed the SIBO and it'll form biofilms. I don't know how many times you've talked about this with clients too, but I know for me, I've had several patients who are very, very concerned and scared of taking iron because they read somewhere, probably on a forum, that iron is going to make the bacteria make more of a biofilm and it'll make the SIBO tougher to get rid of. OMG, they can't take iron. And actually, I was partially inspired to make that video when I did because somebody reached out to me on Instagram and she was asking me this exact question. And couple-fold. I think even at the end of the day, even if you did provoke the bacteria to make a little bit more of a biofilm. If I had to choose, if I had SIBO and also had iron deficiency, I would still choose to take the iron because you need iron to keep your vagus nerve and your gut-brain axis healthy, and therefore you need iron and adequate oxygen supply to run your motility.
Right.
And if you have sucky motility, you're never going to heal from SIBO. End of story. So it's like you have to prioritize things that keep your nervous system healthy and keep your motility going. And iron is one of those really, really big OMFG, you cannot get around this any other way kind of issues. If you're iron deficient, your motility is going to suck. End of story. So knowing that you want to clear the SIBO and knowing how important motility is for SIBO and for IBS symptoms in general, even if it was going to provoke a little bit more biofilm formation, I would still take the dang iron because I want to make sure I can use my brain and I can use my vagus nerve and I can make stomach acid. I can make thyroid hormone. I mean, we have a whole episode on iron and the importance of iron. So go check that out if you have any questions about this. But even so, what I also talked about in this video is that when you search around on PubMed and you start looking at information on biofilms, it's really weird to get into because the vast majority of research on biofilms isn't done in the human gut or even like the human respiratory system. It's done on things like catheters and mesh inserts, basically like implants and medical devices, breast implants, screws. It's all of the man-made stuff that we put into our body in surgical procedures. That's where they study biofilm. Because if you have somebody like an old person in a nursing home who needs to have a catheter because they keep getting recurrent UTIs, there's going to be bacteria forming a biofilm on that catheter, and that could lead to an infection that kills the person. Or, you know, if you had like...
stakes are high.
Or like when I had Lyme disease when I was a teenager, I had a PICC line. So it was a plastic tubing that went in the vein in the cubital fossa of my elbow, went all the way up and into my heart. So literally when my mom was giving me the antibiotics twice a day for Lyme disease, the doctors had a come to Jesus moment with her and they were like, look, lady, you have to clean this thing so good. Because if even, they told her, if one bacteria gets through, it's going to go directly to her heart. And it could kill her. Right. And my mom was like, oh my God. Like she was overprotective to begin with because I'm an only child, but that just made her lose her mind. And that's the kind of stuff. Like if I had a PICC line for an infection and I was getting PICC line antibiotics every day, if there was a biofilm on that device, that could have killed me. Like that would have been a big deal. So biofilm research, 90+% of it is focused on catheters and inserts and devices that are put into the human body that pose a risk for an infection. There's a little bit more research coming out now about GI biofilms, and I'm going to try to work on a YouTube series for that probably this summer. But when you really look at it, even looking at like the catheters and the implants and the meshes and the screws and all of those, the bacteria that seems to do that the most is Pseudomonas. When you look up like biofilm and Klebsiella, biofilm E. coli, there's not nearly as much that comes up with those guys. And again, those... What is that noise?
Sorry, I'm moving. I'm moving up because my back's kind
Oh, okay. I was like, what is that noise?
Sorry.
No, you're good. I was just really confused.
Moving my standing desk.
Well, I'm going to be a bum and sit on my butt on my standing desk for the time being.
Again, I'll probably sit down at some point. I'm pregnant and trying to like maintain sanity with hip and back stuff. But
yeah, nope, you do you. I think thought I was losing my mind.
No, you are not. I think the iron thing's really interesting too because like I think there are like some studies with like IBD in trying to manage iron deficiency. And sometimes it revving up some symptoms and some inflammation. But like the iron that they're using is like shavings from some, like again, it's just like iron shavings that are like horrible and cause symptoms anyway for people. Versus if you're using a heme-based iron, it gets absorbed pretty well. It's not like it's going to be hanging out in the gut versus, and you're taking lower doses of it versus someone taking 165 milligrams of this iron shaving supplement that certainly could cause symptoms and lead to some
even
problems.
A healthy person.
Right, and even a healthy person's going to have constipation potentially, sometimes pain. So, I think like the key thing too about the iron, and I totally agree with you, I would definitely recommend, I've had people just fixing their iron deficiency made the biggest difference for them, which is just insane.
Likewise.
I swear this one lady that I worked with, it was like the thing that helped. And then it was like, okay, it's pretty much resolved. We did 3 months or so of iron. Your iron level looks great now, and everything seems to be where it needs to be. So again, like it's one of those things too. Like definitely the form of iron I think can be helpful. So if you're doing like a heme-based form, that's usually going to work a little bit better. I think there's some other forms too that are a little bit better tolerated. Like
the iron bisglycinate is D's. Like it could still cause constipation, but it's D's. It's better than like the prescription. I call them the Home Depot special pills because I swear to God, it's just iron filings that they crammed in a pill and painted it red. But yeah, I think the form matters. I think also, it's so important. Like even, to his credit, one of the things I've always liked about Datis Karazian's teaching in like the functional medicine space is he's like really big on how to prioritize how you work with a patient. And since I found him and started taking his classes, I know he's always harped on you cannot circumvent anemia or like blood flow issues just in general. If the tissues are not getting enough oxygen, all hats are off. Nothing's going to work. So any sort of anemia or hypoxia type issue is absolutely huge deal breaker. Number 2 is blood sugar. Like you can't overcome squirrely blood sugar if that's behind the scenes. Like you can try to work on the hormones or weight loss or the microbiome, but if people's blood sugar is going apeshit and their cells are getting erratic levels of energy and nutrition from blood sugar being weird, like that's another one. But I appreciate that he's always been very clear that like every seminar I've ever taken with the guy, he takes it back eventually to blood sugar and oxygen delivery. It's like, remember, you can't circumvent these. If they're there, they're going to totally F everything up. So yeah, I mean, like I said, even theoretically, if it led to some biofilm formation, I think it's still more beneficial to get the iron and support your motility. But like I said, Klebsiella, E. coli, like those guys don't seem nearly as nasty with this. When you go on PubMed and you start looking for it, if you type in biofilm Pseudomonas, that's the one where you get a lot of hits all of a sudden. But again, it's because they're studying it because Pseudomonas is a common infection on implants and catheters. So it might not be that Pseudomonas is any more skilled at making biofilm than the other ones, but that's where all the research is. But I proposed in that video, I said, keeping in mind that you cannot diagnose SIBO based on a stool test. However, if you were to run a GI map or a test that looks at Pseudomonas and you had a whopper of an overgrowth of Pseudomonas, that's maybe the one and only time where I would take a little bit of pause and say, let's see if we can just support iron through food first and get a little bit of mileage there. And then we could revisit the idea of the iron supplement. But like I had a guy kind of recently in the last 6 months, we did a GI map and his Pseudomonas level was 10,000 times higher than the top end of their range.
Oh God.
10,000. So it was like, like instead of like e to the 5th, it was like e to the 10th power or something. So it's like move the decimal points over that many times. So he's a good example of like, maybe like try to get iron through food first. Or there are iron patches that actually might be somewhat helpful. Like, maybe try those strategies first. But aside from that, and that's the only time I've ever seen Pseudomonas that high, to be clear, everybody else with like normal or slightly overgrown Pseudomonas, even, I probably wouldn't worry about it. Because like I said, they're researching it because it grows on catheters and implants and meshes. It may or may not be that much more skilled at forming a biofilm, but that's the one that we do have some evidence on that would make me take a little bit of pause. But that's kind of like the short version of what turned out to be a long video.
Right.
But yeah, so iron, that was near and dear to my heart because it came up recently and prompted me to make a whole video about it.
Right. Well, and you mentioned another one that was on my list, which is like the potential that people will diagnose SIBO via stool testing.
Yes.
Which again, like, you could maybe look for some signs that would increase the risk of SIBO.
Or just large intestine dysbiosis. Like, you can have
right.
both, and neither of them are
right.
particularly cool to have.
Right.
Right?
Exactly.
We don't have to extrapolate.
Well, and I think the hard part in the SIBO space is, I don't think we have a perfect or even like super great way to diagnose SIBO in general. Like, again, I the breath test isn't great. If we could figure out a way to actually like logistically in a way that was not cost prohibitive, be able to culture the small intestines, in a bigger way than we have been doing. And again, I know you can do like culture, like aspirates and things like that to diagnose SIBO, but again, those aren't even perfect. So,
and it's not widely available. Like, you can't just
right.
walk into your average run-of-the-mill GI doctor and say, I would like a small bowel aspirate, please. Like,
right.
They're not, that's really more in a research setting than anything else. But I'm so glad that you brought this one up because you're right, it is a big one. And again, like, my thought is like, treat whatever you find on the stool test. Just
right.
don't say that you have SIBO based on a stool test. Like,
right.
you could have large bowel dysbiosis, you could have SIBO, you could have both, you could have neither. Like, but stool testing cannot and will not and will never tell you if you have SIBO, even if it's the same bacteria, because
right.
what you poop out looks entirely different. Even honestly, stool testing really only tells us what is hanging out and living in the distal colon,
right.
like the sigmoid, for example. Even if you compare the microbiome in like the tail end of the colon versus the beginning of the colon, it's quite different. So stool
right.
testing doesn't
right.
even tell us with accuracy what the beginning part of the colon looks like from a microbial standpoint.
Right.
But then, perhaps to your point, like, I'll call out one company because I think this is horse radishes. Do you like that? I censored myself in the moment.
I didn't know we couldn't just say horse shit on the podcast. All of a sudden you've really held back. I didn't.
I wanted to mix it up. Well, and you know what, too, is like, I still have this haunting my brain slightly. A couple months back, I was like, I'm going to look at our Google reviews for the podcast, or Apple podcast reviews. I'm going to look because I tell you guys every episode to leave us a nice review. And most of you have, thank you. But there was a lady who took very big issue with me specifically. She liked you just fine, I think. But one of the big things she said was that I was a big dumb dummy because I curse. And I was like,
oh no.
I'm just so frustrated and perplexed and sad to know that she tuned off our podcast because I said a naughty word. So that goes out to the lady who probably never listened to an episode again.
Well, now she doesn't like me because I filled in the blank.
Because you just swore. Exactly.
Right.
Well, anyway, going back to the test that is horseradishes, that's going to be my new one. Frigging Vibrant America, what are you doing with your gut zoomer test? Right here, they give, I'm looking at my results from a few years ago. They give, under test name, SIBO, and they give you this like green, yellow, red bar, and on somewhere, let's see, inflammation, gut metabolites, somewhere on here, they have, gut microbiome and SIBO. And then potential associated risk, SIBO syndrome. Like, is that your guys' way of acknowledging that you're not actually diagnosing SIBO, but you're tricking everybody into thinking you're diagnosing SIBO? That's what it tells me. So, For example, Vibrant America, full of horseradishes, that's just nonsense. And I forget now, I'm going to look at it again. I forget. I think the BiomeFX might even have a SIBO area on their test, too. Mm. And it's malarkey, is what it is.
Right.
Absolute malarkey.
Wow, we're pulling malarkey out. Things have really heated up here. But yeah,
Puss in Boots.
Yeah, I think that it's tricky because I think some people are trying to find ways to and like markers to potentially indicate SIBO, just because again, I don't think the breath test is necessarily awesome either. So it's
a pain to do.
Right. I mean, again, like it kind of is what it is. Like, we sort of have to use different data points to assess risk of SIBO, and I think you can't just use one thing. But yeah, I've definitely seen people kind of, I know like the GI map sometimes with like the bacillus, they'll put like, oh, if it's high, it could be SIBO.
That one's high on literally everybody. That one drives me bananas too.
Right. But yeah, do you have any other? I have one in the holster too. Another one in the holster.
In the holster. I do have another one. I wonder if I'm going to steal it out of your holster. But I'll say first, just really quickly on this topic, is that if you guys want more information, or if you think that we're big fat liars, and you think, screw you guys, I'm going to diagnose my SIBO with a stool test, you can't tell me otherwise. I have a whole video on that, and I do a screenshot with literature and fancy schmancy graphs and stuff from Pimentel's work, aka Pimentel, Dr. Pimentel's work. That just killed me recently when somebody mispronounced his name. But again, I have a video on my YouTube channel, Triangle Holistic Gut Health. I think it's titled like SIBO diagnosis from a stool test, something like that. It was posted like a year ago. So go look that up, because I do share a lot of the evidence of why we are telling you this. So if you want more background, I think let's reel back to probably the number 2 SIBO myth. The number 1 still being that it's the primary condition or that it's a root cause, because I think that's not true. Number 2 is that you can starve the damn SIBO.
Right.
Like, and there are so many diets, we covered them recently. So whether you're talking about biphasic, low fermentation diet, the, Alison Seebecker hybrid diet, low FODMAP, SCD, low sulfur, whatever, you pick the diet you want to talk about. But all of these SIBO diets have this general premise of starving the SIBO, and I do not think that is true. Or at the bare minimum, we have zero evidence to support that it does that.
Right.
And we do have little bits of evidence showing that when you take rifaximin with PHGG, for example, a prebiotic, the rifaximin works better. So suggesting that feeding the SIBO, quote unquote, might be beneficial, or feeding the good bacteria could be beneficial. But yeah, I have yet to see a single study showing that you can actually starve the SIBO, or starve the Candida for that matter.
Right.
But I really think these diets are more about symptom management, and you only should restrict your diet to the degree that is necessary to manage your symptoms and function. I don't think they're treating the SIBO in any way, shape, or form. And they probably are more likely to do a great deal of harm, because all of these restrictive diets share one thing in common, which is they create disordered eating. And no, 2 things in common. And they lower the diversity of your diet, and therefore lower the diversity of your good microbes. So we know, like with low FODMAP, we know that low FODMAP lowers bifidobacteria and Faecalibacterium, which are 2 really beneficial, crucial keystone players in the ecosystem. Research so far with low FODMAP has not shown a decrease in diversity. I think that probably when we get bigger, better studies, that will be something that they find. I'd be shocked if it wasn't the case. Right. But at the bare minimum, we know that low FODMAP starves 2 really important keystone species in the gut, and that's going to lead to motility problems and inflammation and leaky gut and more problems in the long run. So it kills me to see so many people that are, again, well-intentioned, and doctors that are, I think, well-intentioned, but just misinformed, and they're using these diets to try to starve the SIBO when that's not actually something that we could do.
Yeah, and again, like, I know I wholeheartedly agree with everything you're saying, and I think to even further it, I think we can't always get, like, the best studies for all these particular situations. Like, we almost have to go with what we see with the vast majority of people that we work with. And again, the vast majority of people that we work with come to us on these restrictive diets. And basically the whole trend that I see is the more and longer someone's been restricting, the worse the gut gets, unfortunately. If I saw that these diets were incredibly beneficial and pushing the needle, and that the effort and resources that you're investing into these diets were making a huge difference, then I'd be all for them. Like, again, I'd be all for them if they were pushing the needle. But, just clinically working with clients, and for, 4 years, the consistent trend is the longer someone's been restrictive, or the more restrictive the diet is, kind of the worse the gut gets. And I always remind clients of that. And again, like, I don't think you can starve the SIBO. And I think that you can see that even just with the work that we do with clients. Maybe we don't have a perfect study that, there's no study that says that it can do that. But then again, we also have evidence just working with people on the ground that doesn't really work and can create a lot more problems than it solves. And I think, again, like, this is sort of, I think there's a mentality too. It's along the same lines. Like, there's a ton of people that respond really well to prebiotics. And again, how do you explain that if the SIBO needs to be starved? It's just such a surface level kind of argument. I think when you're just, because the GI environment's so complex, you can't really just starve out one thing without creating potentially some other issues.
Yeah, and I think you made a couple good points there. I think, I might have worded this similarly in the SIBO diet episode. In my opinion, there's no such thing as a biologically free lunch. Meaning, and I'll give a few for instances. Back in, like, the 80s, and 80s and 90s, they said, oh my God, fat is bad. Fat is making us fat. Everything needs to be low fat or fat free.
Right.
And then what happened? We got fatter because they replaced it with sugar. Okay, well then, sugar is evil. We need to get rid of sugar. Oh, but I really want the sweet taste. Like, I want to have my cake and eat it too. And it's like, okay, enter artificial sweeteners. And then we find out, years later, oh, those are really horrible for you in a completely different way. And they don't make you any skinnier, because your brain, like, your body starts releasing these hunger hormones and these satiety hormones, and, like, the cascade of hormones that happens when you eat sugar still happens when you eat artificial sweeteners. So no, you can't taste the yummy sweetness and then not have the consequences of the yummy sweetness. Like, you can't have your cake and eat it too. There's no free lunch. And I shared kind of recently, I don't know if you saw this, but my mom was diagnosed with high blood pressure recently. And the doctor was like, well, here, get this stuff called Accent. And it tastes salty, but it's not really salt. And it's, like, low sodium. It'll be totally great. My husband and I use it. It's great. So my mom buys the stuff, and I'm like, oh, you got the stuff. And I pick it up, and I look at the bottle. It's MSG.
Yeah.
Like, okay. Like, I thought, oh.
You thought wrong.
Oh. Okay. And now it's like, I've got to work on that with her. But, it's like, people are like, but I like salt. Okay. Here's this thing that lets you basically taste salt without it actually being salt, but then it's MSG and you're, like, messing up your nervous system. So going back to this, like, the idea that we could preferentially only starve the SIBO and we can, like, outsmart the SIBO somehow is just ludicrous. Because that's classic human ego for you. Not the ego of the individual so much, but, like, the ego of the collective human species, that we think we're so damn smart that we can outsmart the bacteria. But There's a really good paper. Hold on, let me pull it up actually. And I could quote the name of the paper so that people could check it out if they would like to do so. Hold on. There was a paper, it was 2020, and it was titled, give me 1 second. I have it saved. I'm going to sing to you so that you're not bored because I have it saved for you. Shoot, this is taking longer than I thought it would, though. Come on. Okay. All right. No, darn it. This is embarrassingly long.
What's happening?
So I'm so close. Here we go. Okay. It's a 2020 paper in the journal Cell titled, the title says it all. That's why I had to find it. A dietary fiber deprived gut microbiota degrades the colonic mucus barrier and enhances pathogen susceptibility. People, what are we doing? If you deprive your microbiome of fiber, like FODMAPs and fermentable carbs, they are smart enough. You're not killing them. You might be making them a little bit peeved because they're like, oh man,
right,
I really like that other food. You might annoy them a little bit, but you're not killing them. You're not winning the battle because they're smart enough that they're just going to start to eat you.
Right.
And you start degrading the mucus layer. They start adhering to your colonic cells or your small bowel cells. And then guess what? The bad boogeymen, the bad guys like E. coli and Klebsiella and Pseudomonas, now they stick better. And now you've got a more persistent infection. And now you're off to the races with a genuinely difficult to treat infection as opposed to had you just kept eating the fiber. So right. We are not smarter than the bacteria. We cannot starve them or outsmart them. We have some evidence to show this now, thankfully. But stop trying to feed the dang SIBO. Just reduce FODMAP content in your diet or fermentable carbs in your diet to the degree that it is necessary to keep you functioning. Because I know that a lot of people are struggling, but they also have to, be a parent to their children or take care of somebody or work a job or 2 or 3 or go to school. Like, I know you have a life outside of your IBS and your SIBO. So I get that you need symptomatic control so that you're not like on the toilet all day. I get that. But only restrict your diet to the point that you need for symptomatic control. Don't go into it thinking that you're going to starve the SIBO because to the best of our knowledge, as of 2022, that's just not true. And you're probably doing more harm than good.
Well, and I do think it also, there's just such a huge swath of, or I shouldn't say huge, but there's definitely a swath of people too that aren't responders to, again, the starving the diet approach at all. Again, aren't responsive to low FODMAP or anything that kind of reduces fermentable fibers. They're not responsive to herbals. Like there's a lot of people that aren't responsive to herbals or rifaximin, like clearing, like intensive clearing. There's a subset of SIBO people that aren't responsive to those things, but they just continue to think like, I need to clear. The reason I'm not getting better is I haven't chosen the right ones. And you can kind of get yourself going down a rabbit hole. And then there's sometimes those people are the ones that are most responsive to prebiotics and bumping up fibers and things like that. So there's like some subsets of SIBO too that generally, again, don't fit this mold at all of like intensive herbals, intensive diet change to get symptoms down. Yeah. There's a big group of, or I should say again, like a decent size subset of SIBO that might not do well at all with any of those strategies, but would do well with just prebiotics and kind of working on manipulating the microbiome a bit more and kind of focusing on strategies that are going to build up good microbes compared to the more aggressive approaches. Yeah,
and I've definitely seen that too. And I think that it's like the seesaw kind of metaphor. Right? Like dysbiosis just means that the ecosystem is not balanced. So if you think of it like a seesaw, you could have an increase in the bad bacteria, yeast, etc. Name your critter of choice, parasite. You could have an increase in the bad guys, or you could have a decrease in the good guys, or, heaven forbid, you could have both.
Right.
And the people who respond well to antimicrobials and rifaximin and that sort of stuff probably have at least one component of their SIBO being an overgrowth of the bad boogeyman. And like, I acknowledge that that's there. I'm not saying that it's not a thing, but that's, everybody assumes that SIBO is only that. That it's all just overgrown bad boogeyman, and that's not true. A good majority of people either have both things going on, overgrowth of the bad and deficiency of the good. I would say that's the majority of people. But there are also people who have totally normal levels of bad guys, and it's their SIBO symptoms are purely because they have a deficiency of the good microbes. And then if you give that person antimicrobials or antibiotics, they're going to feel worse. Or at the bare minimum, they're not going to feel better. By the way, what may I ask about your mood lighting right now? Because it's the camera on your eye.
It's really dark here. I think it's storming outside.
I was going to say, you must. Yeah, you all of your nice natural sunlight went away, and now it's.
That's a little better, I think.
Yeah, there you go. There you go.
But yeah, I think that's an interesting one. One other one I will throw out too.
Mm-hmm. This was the one in the holster?
This is another one in the holster. And I think there's kind of two directions you could go with it. One, I think like there's this idea that if you're bloated, that one, you definitely have SIBO, or that the SIBO is the primary driver of the bloating. I think sometimes there's an assumption of that. And there's people, again, that will do treatment or whatever and be like, I'm still bloated. It's the SIBO. I got to keep going down that rabbit hole. And I think, again, like, there's other people that just assume because their bloating is their biggest symptom that they have SIBO. And I'm not saying that you don't want to rule out SIBO and that you could certainly have SIBO. But, I think that there's this idea that if you're bloated, it's SIBO. Like, there's that knee-jerk reaction when there could be a number of reasons why you're bloated, both post-treatment or before treatment. And I also think, too, some people overestimate the degree of which the bacteria are driving the bloating. So, like, when they actually work on digestion and motility, and again, that's affecting the bacterial composition potentially, but like just maybe taking HCl or digesting the food better or moving the food better is a huge driver in their bloating, even more so than trying to manipulate the bacteria. So I think there's a couple different angles of this, but I definitely think sometimes like there's a knee-jerk reaction to say, oh, I'm still bloated or I have bloating. It's the SIBO. I got to keep, like, killing that stuff and keep doing some aggressive stuff to get that under control. When, again, not all bloating is SIBO. There could be, again, different drivers. Maybe there's some SIBO present, but maybe that's not driving the bloating as much as some of these other breakdowns are. And again, they're related. If you're having digestive capacity and motility breakdowns, it could be driving SIBO somewhat. But I'm also, I just find it sometimes fascinating when you have people that have done so much like trying to manipulate their microbiome, and then they take like a prokinetic or finally take HCl or something. They'd never tried it. And they're like, whoa, that significantly reduces my bloating more than anything else. So,
I've also seen things like endometriosis be the primary driver of bloating.
Right.
And we've got that great episode with Cindy. I forget how to pronounce her last name now. But Cindy, she's back there somewhere. I think episode 70 or 80 something, I bet, is where we interviewed her. But in recent months even, I was working with this young woman, mid to late, I think mid-20s. And she had a lot of stuff going on, very chronic bad constipation and very severe bloating. And we got her to the point where like everything else resolved. Like she was pooping every single day. She introduced all the foods. She was eating wheat. She was going to Panera Bread and getting a bagel. And she was like, this is amazing. However, the bloating was still persistent. And she had no symptoms, like menstrual type symptoms with endometriosis, not a one. But I was like, this is peculiar to me. Like we've done everything else at this point. If this was like a microbial thing or a gut specific thing, I would think that we would have made a dent in this, but the bloating did not budge at all. And usually I'm really good with bloating. So I was like, let's have you talk to your OBGYN and look into possibly endometriosis. And I think if I remember correctly, she had been on birth control pills for a while, and that was part of like the confusion was like, all right, is your period really pretty good? Or is it that you're just like medicating it with the pill and you don't really know what your real period is like? Push comes to shove. Before I even knew it, she got the laparoscopic procedure done and they found endometriosis. And the endometriosis person said, I don't think you have it, but I'll do the laparoscopy anyway just to check it out. Sure enough, she had endometriosis. They did the laparoscopy and they took out like the chunks, whatever they're called, lesions or whatever. They took it out. I kid you not.
The chunks.
Chunks. Technical terms, folks. They excised the endometrial lesions, if you will. The next day, she was like...
down, by the way.
Oh, okay. The next day...
Sorry. Sorry, I'm like distracted.
It was all disheveled. That's all right. That's all right.
It's the pregnancy.
You're distracting in the best of ways, as you will find out. Cece will be too. That's okay. But anyway, so she got the laparoscopy done. They removed the chunks, if you will. And the next day, she was like, I was a little bit sore because of the laparoscopic procedure. But she's like, I had never felt better. Zero bloating. Like the flattest stomach I've ever had in my entire life. No bloating. Nothing. She said she went into work like the next day. Her coworkers were literally telling her, wow, you look so great. You're glowing. What have you been doing?
Oh my God.
One day later, I kid you not, people were telling her she was glowing. She looked amazing. Oh my God, what are you doing? But here's the key. And like we talked a few days after the laparoscopy and she was like, this is the miracle cure. And I was like, cool, you're done. And like we thought, all right, our work is done. That was the last appointment. She gets back on my calendar maybe a month later. I was like, what the heck are you doing on here? Why are we meeting? I thought we were done. And she said, I thought so too. It started to creep back in a bit. So we talked more about, okay, we need to support things like, your ability to heal and not lay down new scar tissue, for example.
Right.
Supporting things like collagen synthesis, moving, doing like visceral manipulation or at-home abdominal massage, kind of moving the area around. You basically, like, now that the doctor went in and removed the chunks of the tissue, right? Now your body's going to have an inflammatory reaction in that area, and it's going to maybe want to lay down new scar tissue or stick together, things that you wouldn't want to stick together. So now we need to support making sure that you have like the fluid and the collagen and the vitamin C and the zinc to lay down new connective tissue and not have scar tissue lay down. And we need to move that area of the body as much as we can so that things don't stick and they can glide and slide really nicely. And we want to make sure that we're keeping an eye on nutrition. She was doing great with this anyway, but like things like fish oil and magnesium to make sure that the endometriosis either is well managed or that it doesn't grow back to the degree that we can control that. So that was the last I heard from her. But literally she got the laparoscopic procedure. The next day she was like, oh my God, this is the first time in like 2 decades that, or whatever it might have been for her, this is the first time I can remember where I wasn't bloated at all. Holy crap. And it was endometriosis. Right. So yeah, you'd be surprised. It's not always SIBO.
Right. Yeah, what else? Do we have anything else?
I feel like those are the biggies. Again, like the myths thing is, let me look at one thing. So I have a Google sheet for myself of basically like YouTube video topics of what I want to make videos on. Let me just quickly skim because I'm sure that there's probably other ones. Hold on. I think I actually do have one here. It'll sound like an odd one, perhaps, but I think that there is this pervasive common thought that SIBO is really difficult to treat, or that it's like, it's a chronic condition, it's going to relapse.
Oh, yeah.
Like, it's so difficult. And
this is a good one. This is a good one.
Honestly, I don't find SIBO to be any more difficult to treat. Honest to God, like, I find something like a really aggressive, like, Crohn's or colitis case, I find that to be much more difficult to work with. Yeah. Just because, like, then we have a lot more direct immune involvement, and it can be genuinely life-threatening. Like, with colitis, like, you could lose a colon, potentially, in a bad flare. Surgically, obviously, you wouldn't just poop it out. But, like, I don't find SIBO that difficult to treat. I think that SIBO gets this reputation for being difficult to treat because it's being treated the wrong way. It's almost like if you had pink eye, and then I chose to treat your pink eye by painting the toenail on your right big toe, and then the pink eye didn't go away, and you'd be like, oh man, like, would it be more appropriate to say, hey, you didn't treat the pink eye correctly? Why did you paint my toenail? Or would it be more appropriate to say, wow, the pink eye is really difficult to treat. Oh my God. And I think that that's what SIBO is dealing with these last 5 or 10 years, is that we have the illusion that we know all the things about SIBO, and like naturopaths and functional doctors and nutritionists and the internet and the Facebook groups, like, we all collectively have this illusion that, like, we understand SIBO, we know what's best for SIBO, and these protocols that are out there on the internet, they work. And, like, when you get down to it, like, they don't work. If they worked, you wouldn't be listening to this episode right now. So I think that what we need to do is we need to shift the paradigm of SIBO and start talking about it more as a dysbiosis. So, like, I proposed the title SIMD, S-I-M-D, small intestinal microbial dysbiosis. I still think that is more appropriate. Looking at things like motility, feeding and nurturing the good microbes, watching out for nutritional deficiencies and disordered eating and food fears and gut-brain vagus nerve kind of stuff, making sure that you have enough thyroid hormone, enough iron, blood sugar's not going wacky. Like, SIBO is the ultimate holistic condition, but it's almost never treated that way, even in the holistic space. Like, because even if you get diagnosed with hypothyroidism or estrogen dominance or mast cell issues, the moment you also get diagnosed with SIBO, the so-called holistic professionals zoom in and they go, oh my God, we have to laser focus on the SIBO, with the assumption that if you treat the SIBO, all the other things will go away. So even the holistic professionals hyper-focus on the gut, hyper-focus on the SIBO, and it's like, they forget that these things are a two-way street. Like, yes, histamine issues can get better when you treat SIBO, but also your SIBO symptoms can get a heck of a lot better when you manage the histamine and the mast cell issues better.
Right.
And yes, estrogen dominance can get better if you treat the gut, but also estrogen and estrogen receptor sites in the gut modulate a lot of stuff, including immune activation, inflammation, gut permeability, motility, pain and tenderness, and like visceral hypersensitivity. So, like, maybe working on the estrogen dominant stuff in conjunction with the gut would yield the better results. But it drives me batty. Like, the holistic people just laser focus on the gut, and they have this, like, naturopathic principle of everything begins in the gut. And it does, but also it doesn't. So I think that SIBO is not difficult to treat if you treat it the right way.
Right. Well, and I think, again, like, unfortunately, a lot of the treatments, not only do they not work, but they make things worse.
Yes.
Again, if you're on these restrictive diets forever and you're doing a million different treatments to clear out the SIBO with kind of reckless abandon, not focusing on any of these other areas that are really core to long-term results, it's going to be really problematic. And I also think, too, the problem with labeling it and how it is labeled as, oh, it's chronic, or it's a relapse condition, or it's really difficult. Again, that instills the belief in, like, everyone's heads that, oh my God, I have SIBO. This is a lifelong issue. Like, because, you know, I have people either on Instagram or, again, clients that come to me, and it's like they literally think that they're gonna be like managing this forever. And it's like, I think you can move on from it. It almost reminds me a little bit sometimes with like, I think to a bigger extent, sometimes like with the mold space too, like when it's like, oh, this is like a years of detoxification, like, and you have to be extra careful. And again, I'm not necessarily a mold expert, but like, you know, you should be able to detox mold and move on and kind of, you know, be able to function normally without it kind of controlling your life. And I think SIBO can get like that too, where...
Lyme disease, another one.
Right.
Like, I have chronic Lyme forever. Somebody just reached out to me recently about that. And she kind of alluded to, like, a lot of people's SIBO root cause is Lyme disease. And I was like,
right.
Well, like, I'm not going to touch that one.
Right. Well, and even our discussion with Paul, it's like language is really important. So,
huge. And
how you're thinking about SIBO and how your beliefs around SIBO are really important. If you've been like told, and again, it's probably not your fault, but you've been told you're a difficult case, it's a chronic issue, like that's just what you're going to think and start to believe. And it can take rewiring a bit to create different beliefs, different subconscious beliefs about, you know, what SIBO is and what it's not. And again, I think you're right. Like the paradigm needs to completely shift, and there needs to be a more of an emphasis on, you know, all the underlying kind of root causes that typically don't take a front seat. No. In the SIBO space. Everything's about clearing. And I think it's funny because this kind of goes along with this. I think the majority of people saying difficult, so hard to treat, they think it's so hard to clear. And like, to me, that seems to be more of the easy thing to do. Like, of all the things, clearing, you know, if someone's going to get benefit from clearance, like usually you can tell that relatively quickly. And if they don't, you could move on. But I do think when people are like, oh, it's so difficult to treat, what they're thinking about is like the clearance aspect of it, and not necessarily like looking at the root causes and making sure that underlying breakdowns and dysfunction is being addressed. Or again, the majority of their focus is on starving and clearing and not on rebuilding and repairing.
Yeah. And I think you're right. I think the clearing part is one of the easier things. The key is, when you do the clearing, is it going to stick? Like, or are you going to be that person who takes rifaximin and you feel good when you're taking it, and then like 2 days later, when you discontinue the antibiotic, your symptoms start to come back? Or you do a round of FC-Cytal and dysbiocide, or Candibactin AR/BR, or whatever, name your antimicrobial of choice. You do antimicrobials and you feel good, and then you go off of them and the symptoms come back. Like, that's a dead giveaway that there's something going on. There's a root, there's something else bubbling that you're not aware of, or maybe you're not willing to do. That's another thing too, is I think that SIBO is not difficult to treat if you treat it the right way. And if you're truly holistic and you really look at the individual person and you get out of this crappy space of like, what protocol? I get so many people who ask me on my YouTube channel on a near daily basis for my favorite SIBO protocol, my best SIBO protocol. What protocol should I be on? Or here's all of my protocol. I'm going to send it to you. And you tell me if this is a good protocol. And I'm like, I don't know, because I don't know you. I don't know your health history and your labs and your family history. Like, I can't tell you that. Also, it's like a medical legal nightmare.
What has helped? What hasn't?
Yeah, like what are your symptoms like? Like, what are your primary goals? Like, but I would say also SIBO is not difficult to treat, but sometimes the things you need to do are difficult. And frankly, sometimes people are unwilling to do them. So, like, 2 cases come to mind, both of which lovely people, and I really wanted to help both of them, and we worked together for months, and neither of them made any progress whatsoever with me. And I get this too, like, people, when they're wanting to start working with me, they'll ask, has there ever been a person that you were unable to help? And I'm like, absolutely yes. Yes,
Right.
like I'm not an egomaniac.
Right.
I'm not going to pretend that I've helped every single person who's ever paid me money.
Right.
But
right.
most often, I think, and I'm trying to be humble and like not let my ego lead here, but most often I can identify at least a couple of reasons why I wasn't able to help them. And it wasn't
Right.
because of a lack of knowledge or a lack of skill or clarity on my end. It's because I told them or I suggested something to them and they were unwilling to do it. So like
Right.
the one that comes to mind, and the two that came to mind immediately, both of them the stress management.
Right.
One of them,
Right.
she works 2 jobs. She has 2 kids. One of her kids is kind of medically complex. I feel like anaphylactic allergies and I forget what else. And, like very stressed, like she would get really emotional. She feels really distraught and helpless and like doomed to have SIBO forever and ever. And she's very, very scared. And she's absolutely petrified to add in more foods, but she wants to add in more foods. And I would try to bring up the stress thing with her, but she's in the mental health field. And I actually find that people who are they themselves psychologists or psychiatrists can be the most difficult to talk to about stress because it's like, I have a PhD in this field. Like,
Right.
I know all the things about stress reduction or stress management, but just because you know all of the things doesn't mean that you know how to manage your own stress. And it doesn't mean that you implement the things that you know about. But,
Right.
you know, there was a lot of opportunity where I tried to talk to her about like, you know, I really think the stress is a big part of
Right.
what's going on here. And she just would not hear it. And, you know, we ended up parting ways and I felt really bad because I wasn't able to help her, but hopefully she finds her answers and finds her path down the road. But, similarly, another gentleman, we worked together and he had done all the tests, all the antimicrobials, all the herbs, all the stool tests, all the things. He had been scoped. He's had tubes put in every part of his body and very severe symptoms. He's limited his diet so severely. And there's a really big stressful family kind of dynamic thing that is really frying his vagus nerve. And I tried to give him the tools and help him through what would be a very difficult but necessary decision. Last I knew, he had not done that. And it's like, it's the old, you can lead a horse to water, but you can't make him drink. Like I could try to gently and empathetically point out what needs to happen and what's standing in your way. But if you refuse to see it, there's really nothing I can do. Like, I'm not going to go to your house and like smack you around and tell you, meditate, damn it.
Right.
Like, I can't do that. Or I can't tell somebody you need to quit your job. Like, you need to find a new job or retire a little bit earlier than you planned. I have a patient just last week, she decided to leave her job. And I think that that's going to be really huge for her. She came to that conclusion on her own. But like, there's just stress management is one of the 2 things that I see most frequently. The other one is dietary choices, particularly vegans. I have tried to talk to vegan patients before, and it's not my first thing. I always try to respect somebody's dietary preferences initially. And when I do bring up the idea of consuming animal products again, I try to meet them halfway and talk about like, you know, mollusks or bivalves or like collagen protein. I don't tell people to go from being vegan to eating a steak overnight. And like, I know what it's like to be in those shoes because I was a vegetarian for 11 years and I rolled my eyes so hard anytime anybody mentioned protein or iron. But I have had several patients likewise who were vegan and they were not willing to budge on that. And we got to a point where I thought it was medically necessary, either based on, you know, their intake on Chronometer or their lab tests or our experience working together. And I gently started bringing this to their attention and they were not willing to make those changes. And a big part of me wonders, you know, are these people going to go forth and say, oh, SIBO is so hard to treat. I've been to 3 naturopaths and a functional doc, and I spent all this money, and I've done everything I could, and I'm just doomed, and we're all doomed.
Right.
Like, do they have the perspective and clarity to realize that there is a potential solution and they just refuse to implement it? I don't know. It takes a great deal of humility and perspective to come to that conclusion. But yeah, I think if you treat it holistically and correctly, and if you're willing to actually do the things necessary, even if they're hard, I don't think treating the SIBO itself is difficult. Like I said, sometimes the life choices and the stress management and that sort of stuff, that could be difficult. But treating the SIBO itself, if you implement the things that you need to do, it's really not difficult to treat, in my opinion.
Yeah, I mean, I think it's a really good point about, like, what are the biggest barriers. I think the vegans is definitely one that I've seen be really difficult. I would say the stress side of the equation, I think, is just one of the hardest things to wrangle in if you're, like, down a path where you're at a job that, like, is just
sucking
like
your soul
there's
out.
no work, right? No work-life balance, or like you have a terrible boss or something. I had a client who had like a bad situation where like her boss like harassed her, and then she went to HR, and like it was just creating like the tension, like the level of tension in the office from that point on. Like everyone kind of knew about it. It was like basically traumatizing every time she'd go into work. And it's like, okay, like that's something that's gonna be really
profound.
Really profound and hard to deal with and to overcome if that's kind of the, and I think she was looking for a different job and stuff. It just like wasn't coming to be. But honestly,
too, like if you look at it this way, she would be a freaking weirdo if she felt totally happy and relaxed and at peace and safe at work.
Exactly.
You know, like the response her nervous system is having is totally justified and logical. It's like if you, again, going back to like the caveman kind of theories, if you got chased by a tiger and you barely survived and you were in fight or flight mode, and then you were out in the bush every day collecting berries or whatever for your tribe, and you saw a tiger in the bushes staring at you every time you went to collect the berries, you'd be really weird and like unhealthy if you felt totally fine and comfortable and not at all freaked out. So it makes sense. And similarly, like, you know, just to kind of go off on a tangent, like needing to find another job, like that's really difficult, especially in current times where people will apply for like 50 different jobs, and then it's like a shitty entry position job that pays them like nothing dollars a day and no benefits, and they have giant student loans. Like there's some really nasty systemic kind of like economic and societal factors at play that are keeping people in fight or flight much more than they used to be. Like our parents' generation, like the baby boomers, for example, I think they had it relatively better than like people our age who are really struggling to make ends meet and struggling to pay off student loans and buy a house and just do like what seemed really normal and obtainable for generations prior. But, you know, like needing to find another job or, you know, like money issues or having...
I would say like probably one of the biggest that I've seen is just underlying relationship issues. And again,
that's what I was just going to say. Yeah.
We're not like therapists, so it's not really our job to be like, you know, I think we can point in that direction delicately, but it's usually the clients that, you know, bring it up very subtly. So it's like, oh, my husband really stresses me out, or, you know, my husband's not supportive, or again, like the relationship's not well. Again, when you're in a house, it's similar. I think if there's like tension at work, it's like if there's just always tension at your home where you're supposed to feel safe and that you can be vulnerable and that sort of stuff, and you can't. That's just so hard on the nervous system too.
Yeah. It might even be harder at home because that's supposed to be your safe space. That's supposed to be where you go to relax and unwind and be yourself and lay around in your pajamas and whatever. But and I've more recently too, I worked with a lady, and there's a lot of stuff. She's dealing with grief because she lost a loved one, and it doesn't sound like her husband is very supportive, like at all, actually, at all. He is not supportive at all. And it's really difficult because it's like you said, we're not therapists, but if your crappy relationship, or not crappy relationship, that sounds terrible, but like if chronic fighting or tension or differences of opinion at home are driving the vagal nerve tone issue, it's like, what are you trying to accomplish taking some berberine and some oregano?
Right.
Like if your vagus nerve is never going to feel at peace and safe and comfortable in your own home, then how are you going to try to trick your nervous system into getting it to rest and digest? Like, I don't know. Right. Like it's really difficult. I think, even in a weird way, past trauma would almost be easier to deal with, because at least you could try to do like EMDR or hypnosis, and you could try to like move past it. But if it's something current, like a boss that's sucking the life out of you now, or a spouse that you fight with constantly now, or, something that's happening, or a commute that you absolutely hate, and you're driving an hour each direction in horrible, horrible traffic. Like that's the kind of stuff that's more difficult, because it brings up the point of making some tough decisions. I remember I had a patient with Crohn's, and she still remembered that her symptoms really started when she was commuting an hour each direction in and out of horrible, stinky Washington, D.C. traffic. And, like she's an attorney, so that was maybe part of it too. Like her job itself was stressful, but she remembered when we were talking about her history, she was like, yeah, like the first kind of like IBS, Crohn's-ish symptoms that I had started when I had that hellish commute in and out of DC every day. And I absolutely dreaded the commute, and it was terrible every day. And I started getting to a point where like I couldn't make the whole commute without having diarrhea. And then shortly after that, I was diagnosed with Crohn's. It's like, yeah, that all makes a heck of a lot of sense.
Yeah, for sure. I feel like I might pee my pants soon.
Well, that's okay. I feel like that was more than sufficient. I think we covered some of the biggest SIBO myths that are out there. We debunked them, hopefully. And then, guys, again, Amy's going to explode any moment with baby. She will have exploded with baby by the time you're listening to this, because we're ahead on our recording a bit. But
I hope it's not necessarily explode. She explodes out.
Yeah,
maybe like a nice clean exit.
Yeah, just like a shoop, like down the slide, down maybe the vagina like slide.
Maybe like a quick last sneeze or something, and
there you go. Yep.
Right.
Then out she comes. But next episode 100, the season finale, if you will, because we're going to be taking a bit of a break, letting Amy just learn how to be a mom and soak up all the new baby smells. So comment and wish her well. I'll text her some of the comments every now and then from these last two episodes, but we're going to do episode 100 next week. And that will wrap up season 1 of the IBS Freedom Podcast. And then we will come back from hiatus once Amy has gotten her life back together and all of her lady bits have healed and she's in a routine with Cece being a mom. And we will be joining again. But stay tuned for episode 100 next time. We're going to talk about our biggest lessons, our biggest takeaways, and some of the most foundational stuff that you can do for your gut health from 100 episodes of the IBS Freedom Podcast. So we will see you then. Now go pee, Amy.